Hi, this is Simone and welcome to my channel. I'm a nurse that works from home and I post work from home nursing and other work from home medical professional jobs on this channel weekly, so please be sure to subscribe. Also, please be sure to click the notification bell so that you're notified when I post new work from home jobs. And if you're subscribed already, welcome back and thank you for your support. Now, today I have about 6 jobs, one for medical coder, LPNs, RNs, of course, naturally, and a nurse practitioner job. And did I say medical coder? Yeah, I think I did. Okay, let's get started. So the first one is by Cotivity, and they're looking for medical reviewer auditors. Now, as a medical reviewer, you'll be reviewing medical records to evaluate the accuracy of medical coding. So it's imperative that you would know medical coding, okay? Now, this position you will either be based in Townsend, MD, or you can work anywhere from the U.S., okay? So you'll be conducting medical record audits and healthcare claim assessments for the accuracy of the medical coding and determining the compliance with appropriate policies, procedures, and regulations. So as far as the requirements goes, they're asking that you have your bachelor's degree in a related discipline or equivalent combination of education, professional training, and work experience. They would like you to have 2 to 5 years related work experience. Of course, they want you to be proficient in MS Office Suite. And like I said, you need to have an understanding of ICD-10, CPT, HCPCS, APC, DRG, revenue codes, NCDs, and federal state guidelines, okay, including CMS and NCCI. And they're looking for LPNs, RNs, certified professional coders, clinical documentation specialists, and certified in healthcare compliance. If this interests you, definitely go to the links and apply. The next job I have for you is by Aetna, and they're looking for nurse associates. Now, this is a work from home, full-time work from home position for candidates who live in the U.S. only, okay? So for this position, you will utilize clinical skills to support the coordination, documentation, and communication of specialty medications and or benefit administration determinations, okay? They're looking for you if you have 5 or plus years experience in clinical, such as outpatient, inpatient hospital settings, provider offices, home health care, okay? And if you have managed care experience, that will be preferred as well. Okay, so as far as education goes, they want you to have an associate's or equivalent or higher, and they also hire RNs or LPN. License is required. Next job I have here is by United Health Group, and they're looking for clinical appeals and coding RNs. And of course, this is a work from home position. So as a clinical appeals and coding RN, you'll be responsible for reviewing appeals and grievances to determine if the appropriate care was given. Okay, let's go down and see what else. Now, this is a work from home telecommute position, Monday through Friday, 8:30 a.m. to 5 p.m. And like I said before, you'll be doing clinical appeals and grievances, reviewing coding edits and reimbursement issues, and the rest that's listed down here. As far as the qualifications goes, they will like someone who has a compact license, and if you also have a North Carolina license. And they want you to have 3 years of clinical experience in the hospital, acute care, or direct care setting. And the preferred qualifications, they want you to have your CPC, which is your Certified Professional Coder, and clinical chart reviewing skills. So like I said, with the work from home positions, if you notice that most of them, a lot of them are asking that you have knowledge as a medical coder. So I think it will make you more marketable as a nurse if you obtain your medical coding certification. All right, so if this job interests you, go ahead and apply. I will have all the links in the information box. The next job I have for you today is by Humana Careers, and they're looking for quality compliance RN. Now, this is for those who have a compact license or they have a Florida state license. Okay, now in this role, you'll work from home, but you will need to do occasional traveling for training. And this is a Monday through Friday, 8 a.m. to 5 p.m. Eastern Standard Time position. Okay, now you will be doing quality compliance, professional 2 monitors, quality investigations, conduct HEDIS reviews, and other compliance processes. Now, the qualifications you're looking for: RN license without restriction, strong clinical background in adult care preferred. They want you to have access to high-speed DSL or cable modem from your home office. Satellite internet is not allowed. And they want you to have knowledge of HEDIS, STARS, CMS, and quality. Now, if this interests you, go ahead and apply for the links in the description. The next position I have for you today is also by Aetna, and they're looking for telephonic case managers, and you can live anywhere in the United States. Now, they want you to have your active RN license in good standing in any state, okay, so that you're able to perform your duties. And they would like you to be able to obtain your California RN license or any other license once you're hired. That is required. They want you to have at least 3 years of clinical experience. And in addition, it's preferred if you have your CRC, your CDMS, your CRRN, your COHN, or CCM. Okay? And this is full-time, like I said before. And you can work anywhere in the U.S. And they want you to have your California license eventually. That'll be a plus. And if you're bilingual, that's also a plus as usual. The next job I have is by NCI, and they're looking for nurse reviewers. Now, you will conduct in-depth claim analysis utilizing ICD-9, ICD-10, CPT-4, and HCPCS codes. Okay, so you will conduct medical record audits to determine the medical necessity and or the appropriateness of medical treatments using Center for Medicare Services, CMS, and other national guidelines. Now let's go down to the qualifications, what they would like you to have. They would like you to have your bachelor's degree with an active license or graduate from an accredited or registered nurse program or an associate's degree program or a diploma program, or they want you to have equivalent related experience. They would like you to have 7 years of nursing experience. They want you to have your CPR and your first aid, and you can. They want you to have an active state license, of course. And I believe this position you'll be doing 5 to 10% traveling, either locally or out of state. It all depends on what you're assigned. Okay, the next job I have is for nurse practitioners, and they're looking for clinical nurse advisors or clinical program consultants. All right, so let's see here. Now, in this job, you'll design plans and policies and procedures for the appropriate utilization of personnel such as NPs, PAs, RN, LPNs, MAs, and allied professionals at all the practice levels in accordance with the provisions of professional practice standards and regulatory agencies. So you'll be creating training and educational curriculum to establish and maintain standards of practice and consistent with positive patient outcomes. Okay. Now let's go on to the requirements. They want you to be a nurse practitioner with active license and at least 3 years of on-site experience. Of course, they want you to have your BLS. You have to have excellent critical thinking, communication, and analytical skills, of course, naturally. And you must be able to travel up to 25% of the time. Now, if this position interests you, definitely go ahead and apply at the links in the information box. Also, be sure to check out my other work from home positions on the playlist that I have. Click on the eye in the sky, and it'll take you directly there. If you haven't already, be sure to subscribe, click the like button, and I'll catch you in the next work from home video. Bye!